Hey everybody, Dr. Schultz at the Centeno-Schultz Clinic, the authority on thoracic spine disorders. This is another weekly update and thank you so much for checking in. So today we're going to be talking about the 3 most common thoracic spine surgeries. So again, thank you for checking in. Let's get started. So what in the world is the thoracic spine? Well, it's that space of the spine that's between the neck and the low back. As you can see, it's depicted here on the spine. So the cervical, or the neck, is otherwise known as the cervical spine. The low back is the lumbar spine, and sandwiched in between is the thoracic spine, and it's poorly understood by many providers. So what are some of the common thoracic spine conditions that can result in surgery? There's quite a few, and I've just highlighted the most common. They include a herniated disc, which is actually depicted here. You can see this is the spine, and right in between the building blocks is a disc. And you can see that this disc here in red is depicting a disc herniation. A disc herniation can be an incredibly painful occurrence in the thoracic spine, and it can cause nerve compression and pain. Other common causes for thoracic spine surgery include spinal stenosis, which is basically a narrowing of the neuroforamen or the central canal. You can also have a slipped disc, a fracture, or an abnormal curve, either in the form of scoliosis, that S kind of curve, or kyphosis, with a person that's got an abnormal forward flexion. So the 3 most common thoracic spine surgeries include a fusion. And what it involves, as you can see here, it's depicted, is basically they go in and remove one or more of the discs, then they insert a bone graft or a spacer, and then they stabilize that area with a bunch of screws and some connecting rods. So a fairly invasive procedure, and there's some unique risks that we need to talk about and understand. They include a permanently changed mechanics of the thoracic spine. In addition, the screws that you see here and here are susceptible to cracking, breaking, and actually backing out, which more times than not require another surgery. And then there's this phenomenon called adjacent segment disease, ASD for short. And basically the disc has been removed at this level, as you can see. As a result of that, the disc above and the disc below the fusion take additional pressure and energy, and they can also start degrading and be source of significant pain years down the line. So the second most common thoracic spine surgery is what's called a laminectomy. So let's look at a little of the anatomy here. So a laminectomy is simply a removal of the lamina. Well, what in the world is the lamina? This is the cross-section of a spine. This is the little dinosaur bone that you touch. If you touch your children's or your partner's back, it's right in the center. Off to the side, right next to the facet joint, is the lamina. And it's a very important structural piece. And if you have a disc injury, it can compress the spinal cord. And the spinal cord and the nerves do not like to get compressed. So what they do is they basically cut a portion of this lamina out so as to decompress, basically give the disc and the spinal canal some additional space. Well, there are also some risks associated with the thoracic laminectomy, and they include infection, failure, there's no guarantee it's going to work, increased pain, spinal cord injury, nerve injury, and because we're working in the thoracic spine, you can actually injure a lung, and in some cases it's punctured, otherwise known as a pneumothorax. And by cutting away bone, you also create some instability in the thoracic spine. And then the last procedure I want to talk about is what's called a thoracic discectomy. And basically a discectomy is a removal of a portion of the damaged disc. What's the disc? These are the building blocks of the thoracic spine. and sandwiched between them is a cushion. And that cushion is known as a disc. It's depicted here. But sometimes that disc in the thoracic spine can be injured. You can have a disc bulge or a disc protrusion, and it can cause enormous pain. And one of the surgeries to treat this is a discectomy, where they remove that portion that's damaged, and in doing so, hope to relieve some of the pressure and some of the pain that the patient's suffering from. So it too, like everything else, has some significant risks, which include infection, failure, increased pain, and also a progression of that disc injury. So by trimming it off, you may, in the short term, decrease pain and pressure on the tissue in the thoracic spine, but eventually that thoracic disc is going to get more degenerative and actually can cause additional pain and injury to the adjacent facets. So how in the world do I avoid thoracic surgery? We've just reviewed the three most common: a fusion, a laminectomy, and a discectomy, all of which are associated with significant risks with no specific guarantee that the pain will get better and you will increase function. The key comes down to having an accurate diagnosis. That's right, an accurate diagnosis. Have all the structures in your thoracic spine been evaluated and considered to be a source of the pain? That's essential for any workup. You can't simply look at an MRI and say, well, there's the cause. At the Centeno-Schultz Clinic, we are experts in the treatment of thoracic spine disorders. Have you ever heard of a thoracic facet? It is a pain generator and causes significant pain and dysfunction in the spine. What about, has your doctor ever talked to you about a possible injury of the costovertebral joint? Well, gosh, if not, you haven't had a full evaluation. And having an accurate diagnosis is the very first step to getting treatment, good treatment for your thoracic spine. Thank you so much for watching another weekly update from the Centeno-Schultz Clinic, your authority in thoracic spine disorders. Bye.